Miracle Thorpe, Nate, Jay, Kelsey, and Josh. And the purpose of my informative speech is to emphasize the overall importance of maternal and child health care within today's society. So, does anybody know anybody who has had a premature birth or a complicated pregnancy within our audience?
Yes,
Turn
me.
around, look at the audience.
Yep.
No.
No. Well, this is a main concern within our today's society. And so from there, we're going to start off with a quote from American Public Health Association. And they say that we have the opportunity to end preventable death among all women, children, and adolescents, and to greatly improve their health and well-being. And it should also be noted that far too many women, infants, and children worldwide still have little or no access to essential quality health services and education, clean water and air, and adequate sanitation and nutrition. This would mainly include our lower socioeconomic areas within the U.S. and even in other countries where they do not have access to health care and cannot get the health care that they need when the women are with child or their children need a doctor. There's not enough physicians to patients ratio. Thanks to the federal government agencies such as the CDC, their Division of Reproductive Health monitor maternal and infant mortality and the most serious reproductive health complications. And some of these health complications would include hypertensive disorders, postpartum hemorrhaging, deep vein thrombosis. So hypertensive disorders would include gestational hypertension, preeclampsia, and eclampsia, and these are disorders where women develop high blood pressure before or during their pregnancy. Postpartum hemorrhaging is bleeding after the pregnancy. Is more than the usual. It's a lot more bleeding than normal. And then ways to control this is surgical repair, uterine artery ligation and embolization, obstetric tamponade or uterus or vagina, and a hysterectomy. Deep vein thrombosis and pulmonary embolisms are in the same category because they both do with blood clots that are usually developed within the lower limbs, the thighs, and then pulmonary embolism is when the blood clot breaks off and travels to the lungs and it's just stuck there. And so next we have rates of preterm births and infant mortalities. Your preterm births are when babies are born before the 37th week of pregnancy, and infant mortality is the death of a child before their first year. The Healthy People 2020 want to keep the rate of preterm births at 9.4, and then they also want to keep the rate of infant mortality at 6. And so next, we have programs and initiatives to help control these rates and to prevent preterm births. And so the Health Resources and Service Administration has 3 key strategic priorities: improving women's health before, during, and beyond pregnancy and across their life, improving the quality and safety of maternity care, and improving systems of maternity care, including both clinical health systems. And so some recommended preventative services by the Health Resources and Service Administration is based off of specific populations. So whatever it is in that population, they have recommendations to address just those specific needs in that population. Title V Maternal and Child Health Services Block Grant Program is a key source for promoting and improving the health and well-being of the nation's mothers, children, including children with special needs and their families. So they would need they are given money, and so they have to have record of what is going on with maternal and child health, and from that they are funded through that. And then Healthy Start strengthens the foundations of the community, state, and national levels to help women, infants, and families reach their fullest potential. So they want to make sure that when the woman gets pregnant, that she is okay, and then even during the pregnancy and after the pregnancy. And then Alliance for Innovation on Maternal Health is a national data-driven maternal safety and quality improvement initiative based on proven implementation approaches to improving maternal safety and outcomes in the U.S. So this is another preventive measure in order to just make sure that maternal child health care has fully improved. so overall from this, we see that the goal of maternal and child health is to improve the health and well-being of women, infants, children, and families. And this is from Healthy People 2020.